Hi, everybody. Good morning. It's nice and bright and early. Nice to see all your smiling faces today. Thank you for attending the session. It's about Totally Outright. And probably most of you know about and have heard of Totally Outright, which is, and I'm going to let these lovely guys sort of explain to you what Totally Outright is. What you might not know about Totally Outright as a program that is sort of intended to build leadership and a sort of capacity among young gay guys, is that not only has it been a huge success in Vancouver, but it's actually started to be taken up right across the country. And so the story of Totally Outright is a really exciting story about a real innovation, a real model that picked up a lot of steam and just seems to keep on growing. And so in my role at KD, where I work, I've seen different people and different organizations hear about and want to take Totally Outright up. And so one of the things that we did earlier this week was we arranged a meeting with a lot of the people who had sort of coordinated Totally Outrights in their region, and came together and talked about what that story looked like and how the program grew from an idea in Rick and Terry's mind to something that's sort of a movement that seems to be growing right across the country. So today we were just hoping to give you a little bit of a sense of what that story looked like, and to give you sort of to talk about how a really incredible, innovative program has been taken up and really sort of worked for a lot of people in a lot of regions. So that said, we're going to start off with Terry and Rick, who really have spent a lot of time, obviously, not only sort of pulling us together even to be at summits like this, but really worked very hard to make Totally Outright a reality. And once they're going to talk about sort of the beginnings of Totally Outright, where it came from, its underpinnings, and then we're going to have Jody talk a little bit about some of the amazing stories that he's seen, and some of the amazing outcomes he's seen now that Totally Outright has been around so long. And then we'll have Ricky Rodriguez present. Ricky works at the AIDS Committee of Toronto, which was one of the organizations that really first took Totally Outright on, and now they're doing it about 3 times a year, I think, so it's really grown in Toronto. And then we'll end with Jared Starr, who just completed the first Winnipeg Totally Outright, and it was a huge success. So without further ado, I'm going to pass the mic to Rick or Terry. Who do you want to? I guess
we'll start with me.
Yeah, we'll start with Terry, and then we'll go from there. So, Terry.
I'm going to talk about the historical conditions and some of the underpinning theories that we use to develop Totally Outright. And then Rick is going to talk about the process that we actually use to develop the program. We actually go back 10 years to this time, so 2003, and when we were writing the proposal for Totally Outright. And I just want to review the sort of conditions about that. Around 98, 99, we saw a dip in gay men's activity to the point where it was hard to get practically anybody out to volunteer. And there were really only a handful of people left in Vancouver who had much attention to this. And then around 2001, we were called by Mike Reckart at the Center for Disease Control to say that there'd been a spike in the epi. They didn't know whether the spike would last or whether it was just 1 year, but they really wanted to find out what this was. And as it turned out, this was the spike that never went away, and it was a near doubling of HIV infections from 1998 to 2001, and so we were in it. And so we had to really think about what to do about this, and some of the recovery effort was the creation of the CBRC itself. That handful of people that was interested in, that remained interested in gay men's health, essentially formed the board of the first community-based research center board. And we had some other efforts like Gateway at AIDS Vancouver. Philip Banks put that together. And then there was the Sex Now survey, which was commissioned by the Center for Disease Control. So what we noticed with the first Sex Now survey, which was 2002, was that the youngest gay men were not the risk group that we thought they were. That, in fact, turned out to be men in their mid-30s. But we did notice that they were profoundly lacking in knowledge and involvement. It was very hard to find any young gay men involved in gay men's prevention. So what to do about that? With no training programs, no capacity, and no leadership, our question was, well, who is going to lead the future? And so we really felt that something needed to be done about that. And our thinking was that Sex Now, I should say, was a very much needs-based survey in the beginning, and we saw that the need was for youth, and so that's where we put our energies. And also at that time was the whole idea of gay health was developing, that there was more to gay men's prevention than just condom demonstrations, which seemed to be a lot of what it was, and then we went through the sort of behavioral era in which we included a little more than condom demonstrations, but sexual health became the topic. So we wanted to do something that was more holistic, in which there was simply more to talk about than just simply condoms and sex. We're also really interested in a new epi-theory that was coming forward at that time. And we were very interested in the writing of Jeffrey Rose, who is a British epidemiologist and known to be one of the fathers of population health theory. And it was his observation that most of our energies are put on high-risk individuals. And high-risk individuals in practically every disease are a minority. And even though you might find in that minority of high-risk individuals a high proportion of people who have a disease or an infection, that can never make up the number of cases that you can get from the majority. So let's say your high-risk minority is 15%. You can never get from the 85 or the 80% that you have left there any kind of the number of cases that you could get from that small minority. So it looked to us like this is, in our kind of diagnostic of what had gone wrong with gay men's prevention, this seemed to fit. That we had focused all of our attention on the high risk, and we hadn't really thought about the ordinary guy, and we needed a program that would cover that. We looked at a lot of different intervention models. There was one in Australia called Fun and Esteem, in which it was said that practically every young gay man that comes out goes through Fun and Esteem in Australia. We looked at the empowerment program, and we looked at the popular opinion leaders. And both empowerment and popular opinion leaders were eventually for sale as packages from the CDC. So that got us interested in the idea that, well, maybe we can grow something here in Canada that's an intervention that will be a lasting feature of our gay health world in the future. So we looked at education models. Both Rick and I, in fact, Rick and I met in graduate school in adult education. So we were full of adult education theory and applied a lot of that to the program, and mostly in terms of experiential learning. The kind of philosophy that Rick and I came from at that time at the University of Toronto was focused on experiential learning and the whole idea of very active learning and involving people in highly active learning. And So there, that then developed into a number of components of the program itself. We knew that we needed a recruitment strategy for the program itself, because everything that we'd done to get people involved obviously wasn't working because there was nobody involved. So we thought we had to go through a very special effort to make sure that we had one-on-one contact with young gay men to bring them into the program. And we were looking at that point for people like the popular opinion leaders. We were actually looking for strong individuals who could make a difference to young gay men in their own sphere. We developed it a 40-hour program. There's just a point I missed here, and to say that also one of the very strong models that we used had nothing to do with HIV, but my early youth as a lifeguard. And so a lot of what we developed into the program came essentially from taking water safety and turning it into sexual safety, and we had a new form of lifeguard here and a 40-hour program to train them. So that helped to develop the components of the project. The whole idea of lifeguard training is that you have a classroom sessions and then you have pool sessions, and we tried to do the same sort of thing so that we would have community field work and we would have work in the classroom, and then a lot of active learning when we were in the classroom. So Rick is going to talk about the process that we use to actually develop this project into the form that we see it today.
Mm-hmm. So the question was for us, how were we going to get this done? How were we going to do it? How were we going to work? And where we applied was to ACAP, the AIDS Community Action Program at the Public Health Agency, for money. And we got some year-end money, and then we got money the next year. So we actually worked on this project from January 2004 until January 2005, when we launched the first course, and then we did follow-up work and evaluation work after that. But that was sort of the time period that we were working in. And as Terry said, there was so few people around, but we wanted to get the people that were around, the young people that were around, onto this team. And how could we do that? And also, we wanted to create a team where everybody would be working. It's not like people would just come and advise. No, we wanted everybody participating, taking on a piece of this, doing something. How were we going to do that? So our great friend who used to work at PHAC, Moffat Clark, and I sort of worked on what kind of approach, and he had a great idea about why don't you buy time from the agencies so that when the people come to the meetings, they're on work time and they're doing this as part of their job. So that's what we created. We created partnerships with AIDS Vancouver, and Gayway was there at the time. That was the gay men's program, and Olivier Ferlat, who came from there. Youth Co participated, and Matt Lovick was the person who came from Youth Co. Asia was the Asian outreach project that existed at the time, doesn't now, and Evan Moe came from that, and Romy Chandra came from the center, or community now as it's called. So those of you from Vancouver, BC will know, where these organizations are. And there was a few people from our own organization. And then from the CDC, Paul Harris, the street nurse, got his education time extended so he could spend more time on education and less on the nursing part. So we kind of lined up all of these people and got them to be able to free up some time. And literally for the year then, we met every Friday. So this was the day we spent working on this, and people were assigned things. So Terry mentioned the environmental scan. So yeah, we had to do an environmental scan, what exists in BC for youth, what exists across the country internationally. So people took that on, and they came to the meetings and they presented stuff, and then we had discussions. So it was really organized well in that way, I think. And I think that helped to create a really good product. So we had to work through so many different things, as you can imagine. What was the core program going to be? Was going to do experiential learning and classroom learning and workshop, but what's the core? So that had to be all discussed and figured out. How were we going to staff this? And we came up with a formula of a coordinator, but also a face-to-face recruiter, as Terry mentioned, that there had to be a face-to-face element. If we were going out to try to persuade young guys to come into this, we had to have some kind of human contact. They had to know who we were, trusted in some way, be pulled into it. So that's an important feature of it. We had to do the appropriate marketing for this. So we went to skaterboard culture and kind of picked up the logos and ideas from that kind of culture. The age of the participants, a lot of discussion on the age of the participants. And we decided on 18 to 26 after much discussion. And we wanted highly functioning guys. In other words, we didn't want the guys that were so needy that we would be really trying to address their needs. We wanted a kind of higher functioning guy. And so how were we going to find, or what were the leadership qualities that we'd be looking for? So all of that had to be worked out. And I guess the sense of, if we move forward, we would want the coordinator and the recruiter to come from the group so it could kind of look after itself. A participant one year would be the recruiter the next year, sort of thing. The venue had to be inspirational. It couldn't be a church basement. We were tired of all of that. We had to show young guys that they were valued and that there was, so we had to search around and find a really great place to do this. And the course timing, we had to figure out the timing. Now we do 40 hours, 2 full weekends, but a lot of discussion into that and then the evaluation. So I think that we had a lot to discuss, and I think that we knew this in advance, and in order to be able to do that, we created this way that people would be part of the project and it would feel that it was their work and not off the side of their desk. So I think that was instrumental in sort of creating this situation. So just to end, I wanted to kind of give you a bit of a flavor for, I don't know, some of you know Totally Right, some of you don't, but give you a bit of a flavor for some of the, just show you a few pictures of, especially the first class. He said, just press this button. The magic would happen.
To move the mouse or something?
Oh, okay. Yeah, so that's the first class, and I just want to say, the person that we hired to do the recruiter, be the recruiter the first year, was our wonderful, famous Mike Quagg, and he recruited all these guys. And let me tell you, that was hard work in 2004 to get that many guys together into a program. They were going to do 40 hours over 2 weekends. It's like, and they had to make a commitment that they would do the whole thing. It was part of it. So what's amazing is that people now see from this 2005 class, there's guys working in the field now from here. This is how, I guess, the impact of this. So, the usual thing, lots of activities and discussions, presentations. They all had team projects that they worked on over the whole course, and they had to present their team projects, gay health projects. So they did their placement at Gateway, and they did a street survey evaluating a campaign. So it was a great, and then unfortunately, with all of this work we did, we couldn't find funding. 2007, it didn't happen. It was just the most disappointing thing. But we managed to be able to scrape together money then for the next years, because our commitment was this must be sustained. And so this is the 2007 group. Really great, strong group of guys. Small group, but there's Mike Quay. Yeah. Paul Harris, Paul, who's the street nurse. And we moved to see it's a better venue here. We've got the Blue Horizon, 31st floor, great view, and pretty cost effective up there. Terry doing a thing on Totally Outright. They're presenting, They had so many great projects over the years. Yeah, and they get T-shirts and certainly acknowledgements. They get their T-shirts to go out to do street or bar activities or other venues. Yeah. Fellatio 101, you know.
You can leave that one up for my presentation.
Okay, yeah. There they are out in the street again. They get reward or acknowledgement certificates, you know. So you get an idea, really. This is a different group then. And just to say, anchors this is a participant manual and a facilitator's guide. And Olivier and his colleague Michael Harris wrote the participant guide, which is there, and we've updated it now to this one. And then Mike Quagg wrote the facilitator's guide so that other people could do it. And this is what we're finding now, certainly after quite an extensive time of just doing it here. It's suddenly catching on and everybody wants to do it, and which is fantastic if we can get an intervention going out of this and get it more systematically supported, I think.
Thank you, Rick and Terry. So as you can see, like, so much work and thought went into the origins of Totally Outright, and I love looking at those photos because I see people that I know, that I've met, that did these programs like years and years ago, and they really are working in the field. And I think the best person to talk about that, at least the best person on the panel to talk about it, is Jody.